So what are the trends today? The trends are with genetics in terms of the relation to reproduction and trying to have women give birth to healthier babies. Some physicians now will not treat women during pregnancy unless they're willing to have a whole battery of genetic tests. And there's really intriguing research coming out about how women are blamed for the health of their children if the women refuse to have the genetic tests. So there are studies in Great Britain, for example, that suggest that if a woman from a remote area without access to amniocentesis gives birth to a child with Down syndrome, better medical care is given to that child, which the woman's given more support, where it's a different story if she's refused amniocentesis, then she's blamed for that birth. It's very interesting, and it is an issue that divides along reproductive lines because some of the technologies that are being used are ones that focus on women exclusively, and some of the studies suggest that this is more of an issue to women than to men. It's a Swedish study, 82% of women felt that the couple should make the decision about genetics. Men overwhelmingly felt the doctor should make the decision about what genetic tests should be used. And it may be more important for women than men to refuse genetic services because women perceive the risk of technology more. And interestingly, non-white men are similar to women in that respect. So a really interesting series of studies has been going on. The first one's asked, well, is it because women and men of color just don't understand science? And no, they found that they did understand science and risk and so forth. But that, in fact, and it wasn't related to fear of a recent technological, hazard of meltdown in Chernobyl. And so the researchers in this case, which found systematic differences between women's perception of risk and men's, suggested, quote, perhaps white males see less risk in the world because they create, manage, control, and benefit from much of technology.